Good evening, everybody. As we gather here today, we're reminded that Guelph is situated on treaty land, that it is steeped in rich Indigenous history, as we have been home to a variety of peoples over the millennia. Today, this area has become home to many First Nations, Métis, and Inuit people. As a community, we have a responsibility for the stewardship of this land on which we live and work. Today, we acknowledge the historic Mississaugas of the Credit, the First Nations people who were at the treaty signatures on the territory on which today we are meeting. So good evening, everyone. Thank you so much for again joining us tonight. And can you believe it's February already? Time is just going so quickly. So this series started, I had to think actually and ask Allison, who is our wonderful partner at CMHA, in about June. And it started because actually as a fundraiser for Bracelet of Hope, which is your host for this evening. My name is Tracy Curtis. I am the chair of the board of Bracelet of Hope, also a Rotarian and a Guelphite. So welcome and thank you. So this started as I said, as a fundraiser for Bracelet of Hope. As all wonderful things, when something happens and it is of value, it stretches and grows legs, and it starts to run. And here we are today. So we have done this all on a volunteer basis. All of the people that you see here tonight are all just volunteering their time in their safe homes. So I would like to thank you all for volunteering for all of those months. This is a free event, and it started because we wanted you to have more information right from Helen from CMHA and right from Anne-Marie, and then our guest here tonight is Nicola. And Marva Wisdom, our commentator weekly. So thank you, Marva. So this month, we're not only just fighting a pandemic, but we also want to bring focus on fighting another pandemic, and that is ending systemic racism. And we are fighting both of these pandemics together, and we can do this as a unified community. So please visit Guelph Black Heritage Site website. So they have a wonderful series of events, specifically this month, because we need to all become knowledgeable together to grow together. So the Black Heritage Society is calling on our community to honor the past, celebrate today, but also look forward in the future. So this week, this month's series, we're actually asking you to donate to the Guelph Black Heritage Society, and you can do that right online to their website. So this is how you thank these ladies for volunteering their time, is you can either donate to Black Heritage Society or Bracelet of Hope. And by doing a little donation, that's how you say thanks. So I would like to introduce you to my marvelous friend, Marva. Marva and Anne-Marie all are members of the Rotary Club of Guelph, and very proud to be. Marva is a senior fellow at the Monk School of Global Affairs and Public Policy at the University of Toronto, a senior equity and leadership practitioner. She is the City of Guelph's external lead consultant towards eliminating systemic racism. As a keynote speaker, facilitator, and researcher, she helps her clients embrace diversity, demand inclusion, and build cultures of belonging. So Marva is a director of the Music Geddes Foundation International Arts Everywhere Festival, which is wonderful if you haven't attended, and is a proud Rotarian and co-authored a newly released book called Collecting Courage, Joy, Pain, Freedom, and Love. So thank you, everybody. We hope that you have a great night tonight. Sit back and gather some more information and have some questions answered. And I'll pass it over to you, Marva. So thank you, everybody.
Thank you, Tracy. We're all such great friends. I think we've deepened our friendships on this finding the COVID balance, and I think that's what the world needs: the linkages that we form to strengthen each other, to encourage each other. I am really delighted tonight to be a part of this incredible event. So each month, Anne-Marie and Helen will be the two recurring panelists answering your questions about the mental and physical implications of COVID-19 pandemic. And of course, we will always have a special guest, and I'm going to introduce a special guest later. Dr. Anne-Marie Zajdlik is a primary care physician in Guelph, providing comfort and guidance to thousands during the pandemic. Anne-Marie has become a Facebook sensation in doing all of this, with her daily posts of encouragement and sound scientific knowledge about COVID-19 and other health issues. And indeed, a number of our questions today will be from folks who say, I want to ask Dr. Zajdlik this question. What does Anne-Marie say about this? So, and she's going to answer forthright. And if she's not able to answer some of your questions, I know she'll answer it later from the Facebook page. And Helen Fishburn. Helen, another friend, is the CEO of the Canadian Mental Health Association of Waterloo, Wellington, and she has been working tirelessly, continuously, consistently as a lifelong advocate for increased awareness of mental health issues. She's dedicated her career to advancing the design of an improved mental health system. And we had a great conversation earlier this week about the IMPACT program and the importance of that. And Helen is going to share a few opening comments. Helen is also, along with Tracy and Bracelet of Hope, CMHA Waterloo Wellington is also a partner in bringing this to you. So Helen, a few words from you, please.
Sure. Thank you, Marva, and good night, everyone. Hope you're doing well. I'm just going to provide a few opening comments on behalf of our team tonight. I'm a big fan of analogies, so tonight I'm just going to use a tsunami analogy, as we're in some very tough and deep waters right now, and the waves keep coming. Everyone is struggling to swim and survive in these waters. Some people are natural-born swimmers and are doing okay, and other people can't swim at all, and they need help to be saved. Most of us have our surfboards and are doing our very best to manage each and every day. The tsunami will eventually recede, we know that, and we will have a lot of work to do to repair and rebuild. But in the meantime, we have to keep swimming. Tonight, we're going to talk about all the things that we can suggest that are available to you to help you survive and thrive in the dark and deep waters right now. So you're going to hear about vaccines. We're going to hopefully clarify a lot of things about the stay-at-home orders, and of course, talk about support and resilience. So thank you for being part of this journey. Back to you, Marva.
Thank you, Helen. That was great. And so, as Helen said, we are going to talk primarily about vaccines, but we're also going to talk about mental health and other issues. We're also going to learn about something new since our last time together, and that is the new variants of COVID-19 that is circulating. We're going to hear a little bit about that. How can we continue to protect ourselves during what seems like an unending pandemic? And yes, what could the ending look like? A lot of us are wondering, what does it look like at the end of this? Is there an end to this? It especially taking a toll on many of us, our emotional and or mental health. I'm going to introduce Dr. Mercer, but before I introduce her, I know I keep teasing you with Dr. Mercer being our guest. How many times have I said that? I want to share a few remarks that is really personal to me. It is in reference to what Tracy spoke about, and that is the celebration of Black Heritage Month in Guelph. And as Tracy said, the importance of us working together can't be understated. I want to draw your attention, though, to numbers not worth celebrating in research findings across North America, if not broader. I think it's actually across the world, that COVID-19 is impacting Black and Indigenous people and visible minority people at an alarming rate, primarily due to the systemic inequities that have laid bare. How we as a society enact policies and practices that perpetuate stereotypes, how we sometimes withhold and or provide inadequate service, creating a deep chasm of health, social, justice, and economic disadvantage that leaves these groups more vulnerable to COVID-19 illness and even death. The empathy that has developed in how we see each other through this pandemic is necessary to achieve that just society for the other pandemic that Tracy spoke of. As we mark this month celebrating with the Black community, let's remember what our Indigenous brothers and sisters have been saying. We are all interconnected. Let's take Maya Angelou's words to heart when we think of who we are helping to make whole, who we are helping to heal, who we are helping to strive, as Helen says. What Maya says and what she said, people will forget what you said, and people will forget what you do, but people will never forget how you make them feel. It is my distinct pleasure to introduce Dr. Nicola Mercer. We're so glad that she's able to take a little bit of time to join us today as our Medical Officer of Health and CEO for Wellington Dufferin Guelph Public Health. Dr. Mercer holds a degree in medicine from the University of Toronto and a specialty designation in anesthesiology. She also holds an MBA from Wilfrid Laurier University and a master's in public health from the University of Waterloo. But that was not enough. She decided that she needed to be certified in travel health from the International Society of Travel Medicine. And I know Dr. Mercer is going to share a few remarks with you and comment on what the findings are, especially as related to visible minorities across our county. Dr. Mercer, please.
Oh, thank you, Marva, for that introduction. And for those of you who don't know, all of the panelists have been known to me for years, and probably Anne-Marie first, but Marva, I've known you for many, many years now. So it's wonderful to be asked to be a guest speaker, but I don't really feel like a guest. I just feel like I'm just one of your friends that gets to come and chat. So you did raise an important point about the disparities that this pandemic is showing. And I think for those of you who think, well, it couldn't happen in Guelph, you should be aware that in our data, what it is showing, that if you identify as being a visible minority, you have 5 times the rate of having COVID in our community, 5 times the rate. And that's our area, that's Wellington, Dufferin, Guelph. And truthfully, we don't even have the high numbers visible in minorities that some areas do. So what you're really seeing is that it does disproportionately affect certain populations. And we know that populations, in particular, families that live in multi-generational families, those with large numbers of adults in the same family. And if we look across the province, what we've seen is that some neighborhoods in Ontario, about 20% of the neighborhoods in Ontario account for more than 50% of the cases in Ontario. So COVID hasn't been equally distributed, and definitely there are people and neighborhoods that have been hard hit. And when you're hard hit, that also means deaths and disability from COVID. So yeah, we're going to be seeing a lot of this even after the pandemic is in the rearview mirror. Oh, Marva, you're on mute.
Often now it's working.
Okay.
Thank you. That wouldn't be really good if the moderator is on mute, would it? That doesn't really work. Not quite well. I heard my granddaughter in the background, and so I decided to mute myself. I knew that I shouldn't, so she hasn't gone to bed yet. But Dr. Mercer, that's so important, the information that you have shared. Because sometimes we think things are happening in the USA or other parts of the world, and it's not happening in our own home community. So we don't have to do anything about it, right? We have nothing to do, but we do know that it is happening here. And when you add that to mental health and what the mental health component is, it's very difficult. And with that, and with systemic racism, comes a distrust of vaccines, which is really, really needed. And that distrust is historical. If you think about the Tuskegee Airmen, we used to hear about those guys from way, way, way back when in World War I, Black soldiers who had a flying squadron, and they were able to be significant forces in the war. And they were tested on. It had to do with syphilis, and I can't remember all the details about it, but those issues and other issues of sort of forced sterilization on people of color, and what happened with our Indigenous people as well, all of those things have created a mistrust over the years of the systems that we're in that creates the racism that we've talked about. So how do you then develop that trust at light speed so that folks will recognize that this vaccine is life-saving and this vaccine is important? Those are things for all of us to think about. It may not be, we may not have the answers tonight. Certainly, we're not going to have all the answers tonight, but we'll have some of the answers, and we look forward to that. So a few housekeeping things before we get to your questions. We're going to get to them really quickly. Tonight, you may be joining us either by Zoom or webinar link or via our Facebook Live broadcast. We are ready to receive your questions on any of those platforms. We're asking you to type your questions in that section of either Zoom or Facebook. We'll try to answer every one of them. If we cannot answer all of them tonight, we will make sure that we address them either on Facebook or through another form. And so we are encouraging you very much to make sure that you stay tuned on CMHA's Waterloo Wellington webpage, Dr. Anne-Marie Zajdlik's Facebook and Facebook pages, as well as Bracelet of Hope's webpage. All of that will be posting the recording. We are recording tonight, so go back and visit and listen to that, and bring your friends along as well. And so because we're doing these monthly, we're asking you to please tell a friend, bring a friend along. And if you're able, as Tracy said, to donate to any one of those two charities, please feel free to do so. We thank you for joining us, and we're honored that you're here. We're glad for this time together. And we are in a society, we're in a community of caring individuals that care about our physical and mental well-being as we find the COVID balance. So let's get to our questions. We're here till 8:15. The first question is from John. It says, can you provide information about when we will see vaccination coming to the general public, and which vaccines are we likely to receive? Dr. Mercer, we'll ask you for the first question.
Loaded question.
Yeah, thank you. Yeah, it's not a COVID question, but it's a vaccine question. So that's a great one. And I've been asked this one many times. So
Yes.
the first thing is who's getting vaccine right now? So I think that's important. That's a part of it. So right now we're in the process of doing second doses for everybody who lives, residents of long-term care retirement homes. We really want to protect them. And then we have second doses for the staff that are in those homes. What we haven't done yet is we actually haven't immunized all of the staff in those homes. So we need to do that. And just like Marva said, some of our staff who work in these areas, they're racialized communities, some of them, and we do have some vaccine hesitancy, so we haven't actually immunized all of the staff. So we really need to offer them and continue to reassure them that it is a safe vaccine to receive. We also have our hospital workers. These are the people that put themselves out there every day to keep you safe. So we have some of them immunized with first doses, we're giving them second doses, and we have those to get through. The next step, once we've immunized what I call the most at-risk people in our community, so we will also be looking at those who are going to go into long-term care, so they're what we call ALC or chronic home care people. Our other congregate settings, we know we have other vulnerable people in our community and the people that care for them. Those will be done first, which means we are now moving on into probably around the middle of March. At that point in time, if vaccine supplies allow, we are going to also, most likely based on the province, going to be immunizing those in our community who are over the age of 80 and up. That is something that the province is really looking at, and we know that that group is the most vulnerable when it comes to risk of hospitalization or death. While we're doing them, we also have all our community healthcare workers, and that's a large number of people to immunize. You can see we have large buckets. We know how many people are in these buckets. And if we get vaccine supplies, I think for those of you who are saying, when is it my turn? I'm a healthy person. I don't have any risk factors. By the time we actually get to you, I'm thinking it's actually probably going to be middle to end of April, because what is going to go ahead of you is probably all of the people over the age of 65 and any other categories the province decides on. And believe me, I don't choose. Okay, so I think just for everybody who's wondering, am I the one who's sorting people in the line? I sort of facilitate. If I think somebody's higher risk, I can make sure that they get their place in the line. But what I can't do is change the order significantly. So if the province says we're doing this group next, that's who we do next. So, but hopefully that provides some idea. So, so those of you who are waiting for your vaccine, it's, if you think about it, not that long, just a couple months, and we'll all be able to receive our shots.
That's great. Thank you. That's very thorough. And that ties into the second question that we have. Someone is asking about 2 shot, 1 shot. But the main question is, wouldn't it make more sense to get the majority of the population vaccinated, at least with 1 shot, and get some level of immunity? And maybe Anne-Marie, I'll just throw it over to you to answer that question.
What was the question, Marva?
It was, wouldn't it make more sense to get majority of the population vaccinated with the 1 shot and then get some level of immunity?
I don't think that's a good idea. It's not recommended by scientists and healthcare experts, mainly because the original research shows that you develop immunity after the first dose, but the success of having 91% of people develop antibodies to COVID comes when after you have the second dose, and usually 2 to 4 weeks after the second dose. So if you get the first dose and you give thousands of people the first dose, and then there's a vaccine supply issue, which we're experiencing right now, then those first doses may be totally useless for those people. And you may have to start all over again. We can't afford to start all over again. So I think it's very wise. What the province of Ontario is doing right now is they've given the first vaccine to the long-term care and congregate care population, but they've held on to the second vaccine so that all these people are fully immunized before they move on to the next group.
Great, thank you. The next question is for Helen. Mental health in kids. We've heard that so much. They're trapped indoors and are without their friends, and Marilyn wants to know, what can we do to make sure they don't go into depression?
Great question. So I think the first thing is we're all relieved that schools are back in. That's better for kids' mental health. They're with their friends, they're learning, they're engaged. And of course, we know it's better for parents' mental health as well. They've been doing a lot of juggling. So what I would really say in terms of your kids' mental health is to really keep that conversation open. You want to talk to your kids, you want to normalize what's happening right now, no matter what age your child is. These are uncertain times. We've never been here before. We're still working our way through the layers of this pandemic. So really helping your child understand that, and really just listening is also very important. Sometimes kids just want to vent. We don't have to solve problems for them. We don't have to jump in. They just want to be heard and validated, which is also really, really important for them. Having routines is really important. Kids need structure, again, no matter what their ages are, but not rigid structure, right? We want to have them, we want to give them a lot of room right now, because some kids are learning well and managing okay, and other kids aren't. So their productivity is down. They're not their usual selves. So we want to make sure that they're okay. I think focusing on their mental health is probably the most important thing you can do right now. Yes, school is important. Their grades are not important. It's really about how they're coping, how they're managing, exercising and getting some fresh air, and certainly connecting with their peer group is really, really important. And again, we have to be creative about how we do that right now. What I would say is, you know your child best. So really pay attention to your child. And if you feel like a lot of the things that you're putting in place to help them manage aren't working, then by all means reach out to us. You can reach out to someone at the school, you can reach out to your family doctor, or you can call us at here 24/7. We have a walk-in service for kids that we can do virtually and talk with you about what those concerns are. So we are definitely here to help if you need us.
Great. Thank you, Helen. And to know that you're not alone. There are a number of parents who are feeling the same way. So just don't feel uncomfortable that this is happening to you. The other question has to do with allergy shots for various things like bee pollen, ragweed. Has there been any information posted regarding vaccine and how it interacts with these that folks can be directed to? Paul asked that question.
Is that for me or is that for Emery?
I'll just throw it over to you, Nicola.
Okay. So right now, and unless you're allergist tells you differently, for those kind of allergies, then you can get the vaccine. So what we're really concerned about is people who have allergies to specific components of the vaccine. So if you have an actual allergy to some of the components of the vaccine, you can talk to your allergist, but most likely, and that's not a large number of people, it's a small number of people, but we would be reluctant to give you a vaccine in, say, a typical mass immunization clinic, because it wouldn't be the safest place for you. So most people can have it who have what I call the regular seasonal allergies or the minor allergies.
Okay, that's great. And there's lots of information on Public Health's website as well, about different parts. There's a search component too. If you wanted to find out about allergies, maybe there might be some information there.
Well, it tells you what's in the vaccine, and so you could look that on our website. But most people, their allergies are not what's in the vaccine, and so therefore you can have the vaccine.
Great. Thank you, Nicola. Here's a double question. I'll ask two in one for you, Anne-Marie. The first question, part of it is, should I get the vaccine if I've already been COVID-19 positive? And then the other question is, if you get the vaccine, can you still transmit COVID-19 to someone who has not been vaccinated?
So first of all, if you've had COVID-19, it is recommended that you get the vaccine. The suggestion is now that you wait a month after you've had COVID, a month of being symptom-free. But that's just kind of theoretical. If the vaccine becomes available to you and it's only been a few weeks since you've had COVID-19, get the vaccine. What was the second part of that question, Marva?
The second part is about COVID-19 and whether you can still transmit it once you get the vaccine.
I think that there is now evolving evidence in the ongoing research trials that when you're vaccinated, you do not transmit. I don't think the vaccine trials are far enough to actually definitively say that, but there is some early evidence that you do not transmit. And from a theoretical biological point of view, once you have antibodies, in most other cases, most other infections post-vaccination, you do not transmit. So we are believing that you can't transmit once you have antibodies to the virus.
Is there an incubation period? Sorry, Nicola, go ahead, please.
Yeah, just to follow up, there was a study out of Israel, because we haven't had the science to say what Anne-Marie said. Like we've said, we know that it prevents severe disease and death, but the most recently, and it's just been published, I think today, Anne-Marie, that it's really looking at and just saying what she says, that people who are immunized have lower levels of when we're testing them, so when they get symptomatic, which means we think that they are less likely to transmit, and hopefully that they can't transmit, and that will be great, right? So that's really where we want to be able to prove, and I'm sure we'll find that soon.
And I think the take-home message from all of that is, until 70% of us are immunized, even if you've been vaccinated, until we know for sure that you can't transmit, we should all keep wearing masks, keep social distancing. And we'll probably talk later on about how the new guidelines and how we're slipping into the color-coded system again. We still need to be very careful and stay at home unless it's essential, because of the variants that are possibly out there.
And as Dr. Mercer you talked about 70%, Anne-Marie, and in Israel, I've been reading that they're 75% vaccinated, 75% of their population, which is really quite interesting. So I don't know if that relates to what you said, Dr. Mercer, about the results out of Israel. So I think a lot of the parts of the world is really looking to them because they're so much farther ahead than elsewhere across the world.
I don't know. I hadn't heard they were quite 75%, but what they were doing, they were comparing because they started from the oldest to the youngest, so they were able to compare people who had the vaccine first, so an older generation to the newer generation, in terms of looking for people who had symptoms, and so it was really quite remarkable. But you're right. Yeah. Israel is the country which has the highest amounts of immunization in the world, and so we are going to learn a lot from watching that country.
Oh, that's great. I knew there would be a question about Florida. Segueing into Florida from Israel, I don't know why. And this one is for you, Helen. This person says, I normally would be in Florida right now. How many seniors would say the same? I'm sure a lot. Enjoying outdoor activities and friends. I know others are far worse off than I am, but sometimes I feel so down, I don't even want to go out of bed. Are others feeling like this? And is there anything I can do? It's too cold and icy to go for a walk, and I'm sick of Zoom. Welcome to most people's world, being sick
Yeah,
of
I
Zoom.
must be a senior because I definitely want to be in Florida as well. What I would say is, I mean, who isn't sick of Zoom? We all have Zoom fatigue, although it is absolutely filling an important gap. I mean, here we are right now on Zoom. So let me reassure you, your feelings are totally normal. There are many legitimate reasons for us to be concerned, stressed, or even overwhelmed right now. And it is a struggle for a lot of people. This has been the hardest 11 months of our lives. So a few things to suggest. First of all, don't keep all those feelings stuffed inside. That's where we can go to a really dark place. So I'm really glad you've had the courage to ask this question, because now it's out there and we can talk about it. And that is such an important step. The other thing is, don't try to climb mountains. When you're really struggling to get out of bed, it's really important to set some realistic goals for yourself. So take small but meaningful steps. For example, make a goal for yourself to get out of bed, to have a shower, to make a cup of tea, and to call a friend. Those are really small, but very, it'll make you feel better. And you're not shooting, your goals aren't so big that they're not achievable. That's really important. I think also the greatest gift that you can give yourself is the gift of support. If you think about it, if you have an ear infection, would you expect that you're going to be able to cure your own ear infection? No. So we don't also expect that we can also cure our own anxiety or depression as well. So we're here to support you. There's tons of support out there, and continue to reach out as you need it, but really set those small, important goals for yourself. And I think in a short period of time, you'll feel a lot better.
Thank you. Thank you, Helen. This message is for Anne-Marie. I'd like to go to my massage therapist. I know protocols are in place and we both wear masks, but is it low risk? Is it a safe thing to do?
I think it's very low risk. A lot of these different therapists and people who provide healthcare one-on-one are continuing to do that and have been allowed to do that over during the lockdown period. And I don't think there's been evidence of any transmission in that situation. Nicola might be able to comment on that. But if you're both wearing masks and they're good quality masks, then transmission risk is extremely low. And I think these healthcare providers are also doing pre-screening questionnaires and do not see people if they're symptomatic, which also reduces the risk of any transmission.
Thank you. Thanks, Anne-Marie. Nicola, someone is asking, how much are you taking into consideration the economic effects and mental health effects when deciding about lockdown measures? We spoke earlier about who makes those decisions, so this is a good question for that.
Yeah, so actually I don't make those decisions. So they're all done at the provincial level, and it's actually cabinet who makes the final decision on with the advice of our CMOH. And there's actually also a COVID task force at the provincial level made up of a variety of physicians and other people across the province, including business leaders, that are also provides advice to the premier. So I do have some authority locally, and I can make some local decisions, in particular if there's a local problem or a business that is generating cases, and I can do that. But otherwise, and I can give my opinion to the CMOH, but he doesn't have to take my opinion.
Thank you. That's great. I love that question. It's as if someone heard us in conversation before. Anne-Marie, the question for you, how will physicians pull names of those who require the vaccination before the general public? An example is someone with mental health issues plus diabetes. How is that decided?
How's that decided whether that group is high risk and requires the vaccine before the
Mm-hmm.
general public and the mass vaccination? Right now, public health and a group of family physicians and the family health team are working at determining how people will be notified when their vaccines are available. I think chronic illnesses like diabetes and mental health issues may be in phase 3. And it really depends on the type of chronic illness a person has, whether or not they're in phase 2 or phase 3. But the good news is that phase 2 is going to flip into phase 3 very quickly. There won't be much time between the two phases. And how we communicate all of this to the general public is being determined at the public health level. It's not solid yet how we're going to do that.
Great, thank you. The next question is for Helen. How can we help our high school students, especially grade 12s, who are grieving the loss of their high school life? What resources are available? And we know that schools are opening now, so there's a little bit of hope there. What else can you help these parents with?
It's a really good question, and I will tell you that there are a lot of grief issues that we're seeing across our community, and a loss of some of the major milestones in people's lives is a big part of that. So I'm really, really happy that schools are back, and so that our youth can engage with the supports that are available in schools right now. That's really, really important. And I would say that, again, keeping that conversation alive is really important. Finding ways to recognize achievements and milestones. There are a lot of creative ways. I'm sure many of you have seen graduations and parties and celebrations that people have done virtually. There have been drive-by events. There have been so many incredibly creative ways that people can express their celebration and excitement, which really is what that milestone is all about. So I think it's up to each class to kind of sort what that is and what that looks like. We're coming into graduation season, hopefully, and we're timing it with our vaccines. So you never know what room we might have this June. We can hope for that. But in the meantime, definitely keep the conversation going.
That's great. Thank you, Helen. With our public health, Dr. Mercer was the first to implement a masking policy for indoor spaces. Has there been any discussion to take a leadership role again by initiating an eating outside only policy for schools? An abundance of scientific evidence suggests that large gatherings eating indoors unmasked is unsafe, especially with the new variant. And this is asked by Mark.
Yeah, so I get all the tough questions. So
I'll find you some easy ones next time.
The first part is that up until this point in time, we actually haven't seen that there's been, a lot of disease in our schools. I mean, you would think so. And almost every other disease that we've had over the decades, we've often seen that our youth are the biggest transmitters and the ones that are spreading it around. But we really haven't seen that. Like if you look at the data on schools locally, even when we find cases in schools, and we found cases in schools and we send the class home, but when we follow up with the class and the kids who are in that class and the teachers, we actually have seen minimal transmission. And the schools that we have had transmission have been the schools where they haven't been masking. So some of our private schools haven't been masking, and we have seen some outbreaks in those settings. So I think that's the background. And then on top of that, right now, I think the parents are worried that if you're sitting there eating your lunch before you go out, perhaps, is that a risk? Well, I can't tell you that it's zero risk, but I can tell you that we do not see significant transmission in schools. And I'm wondering if some of that's because children eat quickly, maybe they have smaller respiratory volumes, so they're breathing more shallow than, especially our little kids. There must be some reasons why we don't see a lot of transmission. And mainly the children are facing forward. And I think that's important. Adults, when we eat together, we face each other. We have a coffee. We share that. And I think the question really was, is it less safe now because of the variants? Well, one of the things I can say is right now, currently, we haven't found them in our area. I'm sure they will eventually come. I think that would be difficult to keep them out. But if we want to keep our schools open and our schools safe, the number one thing for everyone listening is please don't socialize outside your family, especially, once our restaurants open, go to a restaurant with people that you don't live with. Please use our restaurants, please order in, please see your friends, go for walks, be outside. But the number one thing that's going to keep us open that we all have to do is don't sneak into your basement with your sister or your brother-in-law or have your kids' friends over, because all of those activities are contributing to the spread of this disease, and we cannot cheat. We keep the disease out of our community, low rates in our community, low rates in our schools. The two are hand in hand.
Great, thank you. It's a fulsome question for you, Mark. Fulsome answer to the question that you have asked. Anne-Marie, a question someone has: in keeping ourselves informed, what is the best, most accurate data to be looking at? Positive cases, positivity rate, or R value?
All of them. So if you look at the color-coded system, I think I posted about this last night. Whether or not you're in green or you're in red or you're in lockdown depends upon the number of cases per 100,000 in your community, the percent positivity, not so much the R value, but the R value certainly tells us how rapidly we're conquering COVID-19. Where I look for those in our region is on the Guelph Wellington Public Health, Guelph Wellington Dufferin Public Health website. They have a great dashboard that puts all 4 of the important metrics right up front. You can follow it every day. It's lovely today because we're seeing the number of people per 100,000 almost dipping below 40, which is key to be out of the red zone, I think, and into the orange. So that's the main website I go to. I also go to another COVID-19 website. If you want to private message me, I can send you to the links of all the sites I go to on a daily basis to watch what's happening.
And she will do that as well. So do private message her. That's great. Thank you, Anne-Marie. That's very helpful. Helen, as Irene has said, that her concern is for mental and emotional health of retirement home residents who are assigned to their rooms. Not even meals at this time can be shared. Usually their only time to socialize. She shared that this home in particular has been free of outbreak and all residents and staff have had their first vaccines. And she wants to know, why can't they share a little meal time because of the emotional and health implications? And perhaps it's a comment that all 3 of you can comment on this, because it's such a big issue, retirement homes. But I'll start with Helen in terms of the socializing.
Yeah, I'll certainly let Nicola and Anne-Marie speak to the whether they're allowed to mingle yet. I'll tell you, we've done a lot of support for the long-term care homes, both long-term care and retirement homes, who are really struggling with COVID-19. It's been absolutely devastating to see what's happened in our long-term care homes with the loss of lives and just the struggle for people with COVID. It's been an incredibly vulnerable population. And I will tell you that the staff of those homes who love and care for those residents have also been very traumatized and struggled. We have sent some of our mental health teams into the homes to provide care and support and help the staff continue to cope because it's trauma. That's what it is. So those are staff that are going to need to be supported for a long time to come. One of the most beautiful stories that we've had recently is some of our staff put together gift bags for retirement and home residents that have not been able to leave their rooms, again, for their own safety. So they put bags together with some chocolates and snacks and large crossword puzzles and word searches and just some readers as well. So a gift bag was given to people in those homes, and what a difference it made. Just simple acts of kindness. We've seen people making snowmen in front of windows, putting signs up on front lawns. We've seen postcards with hopeful messages being sent. There are so many ways we can support our long-term care and retirement home residents right now, but it's really critical to do that. Marva, we
The
have to
second part of the
everything.
question, has to do with eating together and why they can't eat together, especially that they have not had an outbreak.
Oh, well, I guess maybe I can jump in here.
Yeah.
Well, we
Thanks,
haven't
Helen.
finished the second round of immunizations yet. We should be finished by February 24th. That's our goal, to have everybody who's in a long-term care retirement home have their second shot. There are still people that were missed because either they've just got into the homes or they were sick when we went around, but for the most part, most people are done. And then if we go 2 weeks out from that, so now we're looking about, the second week of March in there. So that's when all of this age group are going to be having the best that we can do for their vaccine. We know that seniors, they sometimes don't have the best immune response, but so what we're going to be doing is watching closely what's happening in Israel. We know that it is safer for them, but it's still not zero risk. So this will be an opportunity as we move forward and we look at what's happening with transmission rates. How well do our seniors get protected from the vaccine? Because we do, and public health as well. I mean, we want these seniors and we want everybody to be able to have that relationship. But for now, just for now, we're still asking people to keep their masks on. I know it's not ideal, but it's the safest thing, and we've gone this far. So let's just do the right thing. If I can ask people, especially for the next 8 weeks with the variants, it's very critical. It's really critical. We just keep our numbers down. Every time you guys stay home, order in, but don't go out, don't socialize. You're actually keeping our restaurants open, keeping our businesses open, and keeping our rates low and our schools open.
Thank you, Nicola. And I'm going to stay with you for a moment before I turn over to Anne-Marie for another question. I think Anne-Marie's probably answering a few questions that are coming in too. I could tell by her eyes. The question is about vaccine rollout, the status of vaccine availability, and how public health is partnering with local hospitals and long-term care homes to get frontline workers vaccinated. That's a tough one too, isn't it? I asked you another tough one. The other one was easier.
Easier, maybe, yeah. Well, I think that the good news is that I think that in the next, within the next 2 weeks, we'll have almost all of majority of our long-term care retirement home staff with second doses. We'll have most, if not all, of our hospital staff with their first doses, and some of them with their second doses. So depending on our vaccine supplies, and if we get a lot of vaccine, you are going to see, because we have the ability to deliver a lot of doses really quickly. So if we can get the vaccine supplies come March, you're going to be really surprised as a community how quickly we'll be able to move through these priority groups. If we can give, I don't think it would be an underestimate to say that we can easily give 5,000 a day. We're hoping to give 10,000 a day.
Yes.
So if we, that's the goal, 10,000
awesome.
a day. If we can do that across our area.
We can do that in this community. That is awesome.
That we can do that, Anne-Marie. We can do that. We have the ability. 10,000 a day. Even if we took out everybody under the age of 16, and some people won't get it, we have the ability to immunize everybody with 2 doses in 3 months if we get vaccine. So we should hold on to that. So yes. I think it's possible.
Lots of hope.
That's very hopeful. That's wonderful. Anne-Marie, I hope this is a hard one, and that way it'll be equal to Nikki won't feel, Nicola won't feel badly that I'm giving her the hard questions. Okay. Is the vaccine safe for those with autoimmune diseases such as ankylosis?
Yes, spondylitis. Yep.
Spondylitis. Yep. And can cancer patients receive the vaccine?
Yes. So that's not difficult.
I was trying.
In a large Zoom call with the Ontario Medical Association last week, there were about 1,000 doctors attending the Zoom call. They had high-level experts from almost every specialty in medicine, and universally they said, everyone gets the vaccine. So if you're immunocompromised, you can get the vaccine. If you're on cancer treatment, talk to your oncologist, but most likely they're going to say you can get the vaccine. Pregnant women can get the vaccine. People with autoimmune disorders like ankylosing spondylitis and rheumatoid arthritis, you can get the vaccine. With a rheumatologic or inflammatory condition, you may want to talk to your specialist, because if you are on more than 20 milligrams of prednisone a day, the vaccine may not be as effective effective in you. And some of the specialists thought they might take their patients off prednisone for a week or two before the vaccine, but then they were concerned about people having a flare. So the simplest thing is everyone should get the vaccine. If you have any question, talk to your healthcare provider. But most of the experts are saying, get it. The risk of COVID is much higher than the risk of someone with an underlying condition. Getting the vaccine, no question.
Okay, that's great. That was that was in the middle. I'm doing better. Will we need annual Annika booster shots? That was a question from someone. No?
We don't know that yet.
Okay, not yet. We don't know that yet.
Well,
Lloyd Longfield.
What we don't know, and it'll be sort of a little bit of a guess, is all of our vaccines are against usually the spike protein on this virus. And if those spike proteins change, similar to our flu shot, every year we have to have a flu shot that we have to put something new in it. We do know that immunity to coronaviruses often isn't long lasting, but we don't know about this one. So just like Anne-Marie says, we're going to learn a lot, but I think we should be mentally prepared that we will need boosters. Just how often we'll need boosters is the question.
Thank you. That's great. Lloyd Longfield, our MP, has asked a question. It's a long question. I spoke with a researcher at the University of Guelph today working on vaccine development, who mentioned the need to listening to get input from immunologists and improve our tracking of herd immunity. And then he said, is this something public health is working on?
I guess that's to me then. So
can you say? Yeah.
Yes. So herd immunity is something that some countries have actually tried to achieve that with, natural disease, and they never got there for a variety of factors, including the fact that it's a really bad policy because a lot of people get really sick and die from it. So where we're going to get with herd immunity is we're going to get it with the vaccine. The challenge is we haven't got a country in the world yet that's even remotely close to herd immunity. And so herd immunity is disease specific. So some diseases you need a higher rate than others. But I think if some of you out there are thinking, I'm not going to get the vaccine, I'm just going to rely on herd immunity to keep me safe. Yeah, I would be very cautious about this disease. Very infectious with a pretty high mortality rate, especially depending on your age. So I would say that is not a good strategy to keep you safe. If you have questions about the vaccine, talk to your healthcare provider. See who the people who are getting it, because I want to say that this is the safest way to protect your family and your loved ones is for you to get this vaccine.
Yeah.
Great. Thank you. I think all of us totally agree on that. Thank you for driving that point home. Someone has called in, and this is for you, Helen. The person says, hi there. Hi, we'll say hi back to you. I'm part of a youth not-for-profit sports team. We've been fortunate to continue to do some online Zoom programs and maintain the teens in their peer groups. But we're hearing and seeing that youth are suffering. We're seeking a speaker. It's a request really, who can really speak to youth and really address how they're feeling. And they're looking for a resource and a recommendation for interaction on Zoom. And they're even willing to pay, but I know that CMHA would provide that kind of service to have a conversation with them. Helen?
Yeah, I mean, we have some amazing folks within our children's service, and we have, so if you just want to message me, I'd be happy to make a connection internal to CMHA. Also, this Finding the Balance webinar team is actually going to be hosting a special youth, children and youth session. We're going to add an additional session on to February, just because February is usually a brutal month in the winter. So we want to add some extra support to our community. So on February 22nd, we're going to be hosting another webinar of this group, and we're going to be inviting some special guests who will be speaking specifically to children and youth and family issues. It's an issue that has come up every single webinar. It's came up earlier tonight as well. We know it's top of mind. We know children and youth and their families are really struggling through this pandemic. So we're going to have a special evening just for that. But I will also be very happy to connect you to a specialist within our shop.
And if you could just send your message to CMHA's website, that would be really great. and then you'll have a response, or even contact CMHA directly and reference the COVID-19 Finding the Balance. That makes sense, Helen?
It is. Yep,
Okay,
absolutely.
great. Nicola, are you offering information sessions for frontline staff who may be vaccine hesitant? Is public health offering that service?
What I can say is I have done one. So the first group I did was for PSWs, or for staff who work in long-term care. So that was done and it was recorded. The
Yes.
information was current as of that date. Certainly, we're certainly open to being able to talk to groups of people, whether it's, so I have to understand what the group is. Are they healthcare workers? Are they non-healthcare workers, depending on the group? But yes, it would either be myself or Dr. Matthew Tenenbaum or other staff members, because we do want to make sure that everyone has the information that they need. And we also can link, and we have some videos on our website. We try to link, and I'm sure even Anne-Marie knows some, to other people who speak about the vaccines, trusted sources that have run some videos. So happy to consider.
Thank you. That's great. I think the follow-up question as well, the risk of healthcare workers not being vaccinated, should they continue to work with vulnerable people? I'll throw that over to you, Nicola, still, and then go to Anne-Marie after.
This is a really tough question. So in fact, I was actually talking just today about this exact question. So if you're a healthcare worker and you're offered the vaccine and you refuse to get it, you actually can give this disease to your patients, to your clients. So we all have an ethical duty to receive the vaccine to protect our staff and to protect our patients. So if we don't get it, and we are able to transmit the disease, I think it puts us in a really vulnerable place as healthcare workers, and a place of liability and loss of trust to our patients. So if you are listening and you are a healthcare worker, you have questions, let us help you find the answers to those questions, because I really believe that it is our moral and ethical duty as healthcare providers to take the vaccine to protect our patients and our clients.
I think we saw this, just to add to that, Nicola, I think we saw this with our long-term care staff who were initially very hesitant to get the vaccine. And there are lots of reasons, many of which we've mentioned tonight. But as they've looked around in their home and they've seen residents die from COVID and others struggle, and they've seen their staff, their colleagues get COVID and really struggle, and some of them have died as well. I think they've really supported each other around their concerns about the vaccine. And it hasn't been, the government mandating the vaccine. I think as a group, they've really learn to trust each other and support each other in getting the vaccine. So it's really come from within that group. And now we're seeing many of our long-term care staff who were initially hesitant wanting to get that vaccine now, which is really, really, we're very thrilled about that. So that's been a really nice change and movement. And they don't want to be guinea pigs either, right? So there's a lot more evidence now that we're seeing, which is also helpful.
Great, thank you, Helen. In follow-up to that, another question from someone else calling in, wondered why staff would not be vaccinated at the same time as residents. And that's quite the opposite problem. The residents just had their vaccine, but not the staff.
I can answer that one.
Yeah.
So the main reason is because the residents and the staff have actually had two different vaccines, at least in our area. So we received Pfizer vaccine, which we were giving to staff, and a special shipment of Moderna vaccine, which was for the residents. So when we go into the homes, we usually go in with one vaccine. So I agree, it looks a bit odd. And then the second reason is because now that we have supply constraints, so all of the residents are getting their vaccine on the 21-day or the 28-day cycle, depending on the vaccine that they've had. But all of the staff or the healthcare workers are actually having their cycle extended a little bit, up to 35 days. And because we just don't have the vaccine. So sometimes when we go in the home, I can't give it to the staff because I don't have the vaccine for the staff. So hopefully that will be a problem that will go away when we have more supply.
Right, thank you for that. And we have two questions for you. When do primary care nurses who work in doctors' offices and clinics get vaccinated? That's the first question. And the second is about, are there any details for the community about how the general public will become aware of how access to the vaccine, when that will be in late April? Someone wondered whether they'd be notified digitally or by mail? And between you and Nicola, you could answer that for me.
So I'll answer the second one first. We are actively in the planning stages with several groups of experts in our area to determine how best to, this sounds like a political answer, to determine how best to communicate with everyone. It could be through your physician's office. It will be through various news outlets and public ways of communicating, specifically for the mass vaccination clinics that will be available to people. When the information is communicated, it will tell you to go online, most likely to book an appointment. For people in phase 1 and phase 2, they may need the family physicians in the area to find the people who meet the criteria for phase 2 vaccinations. I might ask Nicola to answer the question about primary care nurses. As far as I know, physicians as healthcare providers in their offices may receive the vaccine late phase 2, possibly as part of the mass vaccination clinics. And that's because it's all done by risk. So in the primary care office, I'd hate to say it, I'm in full PPE. I screen patients before they come in, and I'm keeping the interactions very short. So as a healthcare provider, I'm kind of the lowest risk when I'm compared to people who are working in critical care or emergency rooms, or at COVID vaccination clinics, which are about to pop up, or at the COVID testing site, or people that are working in long-term care. So I'm not sure we know, but I believe it will be close to the end of phase 2, rolling into phase 3. Nicola, do you know that at all?
Yeah, we're having discussions just today on this very issue about our community healthcare workers, and I'm going to talk about all community healthcare workers. So whether you're an optometrist or nurse in an office, a physiotherapist, massage therapist, dentist, whatever you are, all of you as a community healthcare workers, we know there will be about 10,000 of you in our area to immunize, and it's our hope that you will at least have your first dose in March, and depending on when you and hopefully shortly thereafter, maybe the beginning of April, get your second dose. So our goal, and I hope that you will all have your first dose in March. So hopefully that's my goal, and vaccine supplies permitting, we'll do that.
Yeah.
That's great. Thank you. Thank you both. I think you've answered a number of questions in that answer. Helen, Susan says, hi, everyone. This is for everybody then. Thank you for hosting another great event. And our family is safe and physically healthy, although lately seemingly struggling with all of the information and, importantly, misinformation out there regarding vaccines, efficacy, COVID, fact or fiction, and even mask wearing. Some of it is burnout, but for the adults under 60, over 20, the fuse is shorter and shorter as we forge ahead. Any suggestions for coping with the effects of all that information, good and bad? Helen, how do we sort through it?
It's a great question, and I think we're all struggling with that right now, to be honest, because we're overwhelmed with information. And it is hard to know sometimes because the information actually does change really quickly. And Nicola can certainly speak to that. You know, we had a whole vaccine plan and then an unexpected supply issue, and then the plan had to change literally on a dime. So things are changing really quickly. And I think there's a lot of misinformation, and a lot of people are checking news sources which aren't very credible either. So make sure that you're checking credible sources. Check those credible sources daily, but please don't fixate on them because there is a lot of information and it can be overloading and feel overwhelming as well. There are very quick and simple things that you can do to stay grounded and stay calm. So check your news sources, shut off your TV, shut off your radio, and then do things that replenish yourself. So pausing, resetting, nourishing, those are very simple things that you can do just to be self-reflective, just to make sure you're paying attention to what your body and your mind are feeling, and then finding ways to nourish your spirit and your mind. Again, very simple ways, but the more aware we are, the more self-reflective we are, then we're able to make sure that we're paying attention to those things and finding ways to calm ourselves. just as a caution, if we're not aware of those things, then they come out in other ways. We drink too much, we eat things that aren't good for us, we're in our car driving too quickly. There's all kinds of risk factors associated with not being aware. So again, pause, reset, and nourish.
Thank you, Helen. Thank you. That's great. Pause, refresh, and nourish. I think that should go on the website as well, if it's not there already. Another question, and this is sort of thrown out there to everyone. Is there a database of elderly people in Ontario that they're using to figure out who gets the vaccine when? And the person is just curious, with parents in their 90s and diabetic, but still living in their own home, they're concerned that they might be overlooked. That's a really great question. I have parents in their late 80s, early and late 80s, and I think about that as well.
You want me to
So
take
just
this
for
one,
anyone,
Anne-Marie?
yes,
Yeah.
yes, please, Nicola. Yeah.
So the first thing is that I believe quite strongly that fairly soon, in the next few weeks, so probably between now and the middle of March, we're going to be putting a call out for everybody who's living in the community who's over the age of 80. So that would include anybody in their 90s. So our community living seniors. So unless our vaccine supplies are very limited, and I'm being hopeful here, we want to immunize that population. We want to immunize them first. So if you have parents that are in that age group, or grandparents in that age group, please keep your ear open, because we will be advertising it. We will use both traditional media and social media. I'm sure our primary care offices will also be telling people, so that we can get them registered to come and get the vaccine. Okay, so that age group, the over 80. If you're under 80, I think that we might have to wait a little bit longer yet. There'll be others that will be immunizing, probably some of our healthcare workers. But we do know that that age group is the highest risk for being hospitalized and dying. So I do care very much that we find this population and that we get them immunized. We know statistically from Stats Canada, we know approximately how many that we are, but Stats Canada is only sort of it's an interval. But we do know approximately, and your OHIP card, by the way, tells you how old you are. So when our database gets loaded up, it will have everybody's health card number in it, and health cards tell people ages. So we'll be able to pull and look at that as well.
That's great. Thank you. We have a question about the variant. We didn't talk very much about that tonight, so maybe let's touch on it as we get moved toward 8:15. When do we expect that we will know conclusively whether the present vaccine will protect against the variant, and what is the planning that's being put in place by the government should it land on our shores, at least in this region?
And Maria, shall I do it, or do you want to go?
I'll answer the first part. I think the variants have already landed on our shores. There are more and more cases of the variants every day, not in alarming numbers, and I don't think people need to be alarmed. They need to wear a mask and stay socially distant. So the same restrictions and recommendations we're living with now, the public health recommendations, will still be protective against a variant. But if you're gathering when it's not recommended that you gather, these variants will whip through a crowd very quickly, and there's a good chance everyone in the room will become sick. So that's why we're really stressing that people not gather yet until our health authorities have told us when and how we can gather. In terms of whether or not the vaccines, was that the question about vaccines being safe against the variants?
Yes.
Emerging evidence is showing that they are effective against the variants, and I'll have Nicola talk more about that. But we need more time and more research to be sure. Certainly the messenger RNA vaccines can be shifted and new vaccines created to work against new variants, but that's a process. So I think what's important for all of us is to keep our numbers low, keep the variants in our community low, so that the vaccine is very effective, because the most common strain will be the shall we say, wild strain or first known strain of COVID-19.
Yeah, and just to add to that, it's going to be really important that you wear a mask and you wear it properly. So if you've got a single layer mask, please don't wear them. You need a 3-layer mask, ideally a good quality mask. Wear it well, wear it all the time. keep your distance. And just like Anne-Marie said, one of the things that we do know about these variants is that they're more transmissible. So you may have gotten away with having a coffee with your friend for 15 minutes in the past, you may, but now you won't. So what I'm saying to you is that you really need to be really mindful about this variant. And so please don't gather. We need to get people immunized. And for those, for the gentleman who asked me questions about, the schools and the variants, yeah, we are learning. And believe me, I will not hesitate to implement measures that I know are going to protect our children or our population. I will definitely do it. I'm very much following this issue about the variants. And from a vaccine perspective, just like Anne-Marie said, I think we have a pretty good idea that the UK variant, which is the V117, but that's UK variant, it appears like that one is probably covered. So I think we're pretty safe with that one. The other variants, I think the question is still out. And the vaccine, the AstraZeneca vaccine, hasn't even been approved in Canada yet. So I think that we'll have to see what NACI recommends for the guidelines. So more to come. But the most important thing for your listeners is faithfully wear a mask. Don't take it off when you're around somebody that you don't live with at all. Please, please do that. Keep your distance, keep your hands clean, and don't gather.
Yes, and wash your mask. And Marie told us that she comes home, she sort of takes it off at the top, just around her ear, and put it in the sink, hot soapy water, wash it, hangs it for the next day. That's the other thing, especially with the elderly sometimes, or even with younger people, washing those masks is so important, because if you keep wearing it over and over, sometimes I see people who forget and they turn their mask inside out and they're wearing it. I'm thinking, oh dear, that does not work. So yes, that mask protection is primary, because of course, we're still in the midst of trying to get folks vaccinated. This is really great. We only have 5 minutes left. In that time enough for maybe 2 other questions. And I'm going to ask this to Helen. We haven't seen our grandchildren ages 1, 3, and 5 for almost a year because of COVID. Will that cause a permanent disconnect with them? A very brief answer, Helen, because then we're going to just do the wrap up.
No,
the brief answer is no.
That will not cause a permanent disconnect. It's amazing how much memory kids have, and smells and sounds and touches will come back very quickly. And there'll be a lot of love for a lot of years ahead. So hang on to that.
Okay, I think right now this would be a really great time for us to have some closing remarks. A friend of mine has phoned in to ask about caregiver status. If we're taking care of our aging parents, when do you achieve caregiver status? Maybe that's something that could be typed and sent, especially if they're 80 and living alone. There are lots of other questions left, but we've answered a ton of your questions and we're glad that we were able to, but we know that there are more questions than time. We will attempt to answer some of the rest of them for you, especially the ones that are not necessarily repeated. And right now, we just want to say thank you so very, very much for signing in, for tuning in, for listening, for hearing, for us really building community around finding the balance. I think we're hearing that we sort of need each other. We need this kind of support. And we're very fortunate to have Nicola and Emery and Helen to provide some of the answers that you might be looking for. And we thank them so much for working so tirelessly. I don't envy any of your jobs, and especially not yours, Nicola, not right now. So let me just ask you for closing remarks. Maybe we'll go the other way and we'll start with Nicola and Anne-Marie. Maybe Anne-Marie first, because Anne-Marie, you didn't speak at the beginning, and then we do Nicola and then Helen.
Okay, so this is based on science, based on understanding how far we've come so far, and based on being in groups of people who are planning our vaccinations. Here's what I think is going to happen. I think for the next 2 months, we still have to hunker down. I think we'll be able to go to restaurants and support our small businesses again, but we have to wear a mask and stay socially distanced. 2 more months minimum. And then in April, I think we're going to see a massive shipment of vaccines coming every month, April, May, and June. And we're going to be so much more positive when we see the mass vaccination clinics open up and we see people being called in to become vaccinated. That's going to give us the energy to continue wearing a mask and staying socially distance. It will be a totally different arena and mindset come April. And then by the fall, I think we're going to start to see the effects of the vaccine and be much more, we'll see the light at the end. I already see the light at the end of the tunnel, but I think everybody else is going to start seeing it in the fall.
And I just want to add to that to say we have come so far. If you are listening to this tonight, you have been doing all the right behaviors, you have come so far. So please don't stop now. I think if you can hold on for that 2 months, maybe just a tiny bit longer, we are not talking about another year. We are talking months. Please hang in there, do all the right behaviors. We want to get to the finish line together. So if you drop your behaviors now, how tragic to think that maybe not all of us will get to the finish line because we don't do the public health measures. So spring is coming. You can hang in there. You can have that nice outdoor, physically distant barbecue, maybe towards the end of April. Who knows? Maybe nice for Easter if the weather holds. But please, please, for the next couple months, hunker down, do not gather, and wear a mask, and we'll be able to stay open.
One more thing, Marva. I have a glass of wine here. I'm sorry, but if anybody has a glass of wine, just toast our medical officer of health. She's by far the best one in the province. She
I'd
is
like to go get one, yes.
any curve.
Here. I don't have this, but
I am so grateful she is. Well done.
I'll have one for you after, Nicola. It's wonderful.
Oh,
thank
you. Thank you so much, guys. Thank you. I appreciate it.
No, it's been awesome. We've been so proud of you. We've been cheering you on. I'm going to go to Helen very briefly, and then Tracy will wrap it up for us.
So just going back to my analogy at the beginning of our webinar, that's tsunami. We're all in the water. We're all swimming. And even though we can see the beach, we know that there's definitely hope on the horizon. Some of you might need some help in that swimming. In fact, we all do, right? There might be surfboards that we can use if you just need a little bit of help. Some of us might need a life preserver, and other people might need a lifeguard. So be aware of yourself in that water. Know what you need to be able to get through to the next few months, and please access those supports, whether they're informal, whether your family doctor, whether they're with us in the mental health and addiction system. We have virtual counseling. We have some amazing online programs. You don't even have to leave your home, but we also have some face-to-face care for people that are really struggling. So just be aware of where you are in that water and what you need to be able to continue to swim.
You're good, Marva? Yeah, good. Okay. Helen, that is so, because you can actually feel it of whatever you need that day, and it can change day by day, but also, I guess, also look out for your neighbor and your colleagues of seeing what they need if they're not even able to see it themselves clearly. So well said. Thank you. Thank you, ladies. Thank you, Nicola, for taking the time to join us. And thank you, Anne-Marie and Helen. And thank you, Marva, for managing the questions so beautifully. And thank you all for joining us. So just a reminder that our next event is actually on February 22nd, and we are gearing this to the youth. So you can come as a parent, bring your child, or the child can sign on in another device, and they can listen on their own time, but we really want it to be focused between the ages of 12 to 25. But yeah, so please join us on February the 22nd. We'll be sending out more details about that. Thank you to the team of CMHA. So that's Allison and Tanya for putting this together and managing the questions. And please donate to the Guelph Black Heritage Society. You can do that online, or Bracelet of Hope. You can do whichever you feel comfortable. So take your time to find out what events are out there for our Black Heritage Month. And thank you all, everybody, and be safe. We'll see you on the 22nd, and if not the 22nd, we'll see you next month.
See you soon.
Yeah, thanks, everybody.
Thank you, Tracy.